G'day folks, Dr. Zoe Mitchell here. And before you jump on the NoFap bandwagon or start worrying about whether you're doing too much or too little down there, you need to hear this. I've been working as a urologist here in Australia for over 20 years, and the number of blokes who come into my clinic with questions about masturbation and what happens when they stop. Mate, it's more common than you'd think. So grab a cuppa, settle in, and let's have an honest chat about what actually happens to your body when you decide to give the old fella a rest. Right, so here's the thing. This topic gets people talking, doesn't it? Misunderstandings, myths, a fair bit of embarrassment, thrown in for good measure. But masturbation is actually a completely normal part of male sexual health, and I reckon it's about time we talked about it like adults. Many of you blokes out there are curious about what happens physically, emotionally, and psychologically when you decide to abstain. Is it dangerous? Does it actually have any benefits? Will you turn into some kind of superhuman, or will your bits fall off? Well, I'm here to give you the straight goods from a medical perspective, backed by over 2 decades of experience in this field. Now, I need to be upfront with you. What I'm sharing today is educational information based on scientific research and my years of clinical practice. But remember, this isn't a substitute for proper medical advice tailored to your specific situation. If you've got concerns about your sexual health, always have a yarn with your GP or a specialist. Fair dinkum, your health is too important to leave to chance. Let me start by giving you a bit of context. Masturbation is incredibly common among men of all ages and cultures. Studies reckon that more than 90% of blokes have masturbated at some point in their lives. That's pretty much everyone, isn't it? But here's where it gets interesting. Some men choose not to do it, and their reasons vary. Could be personal preferences, religious beliefs, or maybe they're just curious about what happens if they stop. And you know what? There's no one-size-fits-all answer here. What I can tell you is that this choice can have both physical and emotional effects on your body. Before we dive into what happens when you don't masturbate, let's talk about why it's actually considered beneficial in the first place. I know, some of you might be thinking, come on, Doc, isn't this just something teenagers do? Well, not quite, mate. Masturbation plays a legitimate role in men's sexual health, and there are well-documented physical and emotional benefits that come with it. First up, prostate health. Your prostate is a small gland about the size of a walnut, sitting just below your bladder. Regular ejaculation, whether through masturbation or sexual activity, helps clear out toxins and prevents the buildup of seminal fluid. This can reduce the risk of prostate problems down the track. Think of it like clearing out the pipes, if you will. Some studies have even suggested a link between frequent ejaculation and a lower risk of prostate cancer, though the research is still ongoing. Second benefit, stress reduction. When you have an orgasm, your body releases dopamine and endorphins. These are your feel-good hormones, the ones that make you feel relaxed and happy. They can help reduce stress, improve your mood, and contribute to your overall well-being. After a long day at work or a stressful week, it's actually a natural way to unwind. Third, masturbation helps with self-awareness. You learn what feels good, you understand your body better, and you figure out your sexual preferences. This isn't just about pleasure. It's about developing a healthy relationship with your own sexuality. It can actually improve your sex life with a partner because you know what works for you. And here's one that might surprise you. Better sleep. During orgasm, your body releases chemicals like oxytocin and prolactin. These can promote relaxation and help you drift off to sleep more easily. I've had patients tell me it works better than counting sheep. Now, having said all that, I want to be clear about something. Just because masturbation has benefits doesn't mean abstaining will destroy your body or cause lasting damage. Everyone's different, and some blokes might actually find benefits in taking a break. The human body is remarkably adaptable. So let's get to the meat of it. What actually happens physically when you stop masturbating? Well, your body doesn't just shut down or go haywire, but there are some changes you might notice. These effects vary heaps from person to person and depend on factors like your age, general health, and whether you're sexually active in other ways. The first physical effect involves your prostate. Like I mentioned before, regular ejaculation is good for prostate health. When you stop masturbating, especially if you're not having sex either, you might be at slightly higher risk of something called prostatic congestion. This is where seminal fluid builds up in the prostate gland. It's not dangerous, but it can be uncomfortable. Some blokes report a feeling of fullness or mild discomfort in the pelvic area. The good news is, your body has a natural way of dealing with this. Which brings me to my next point. Wet dreams. Remember those from your teenage years? Well, they can come back. Nocturnal emissions, or wet dreams as most people call them, are your body's natural release valve. When you're not masturbating or having sex for an extended period, your body needs to get rid of stored sperm somehow. So while you're sleeping, your reproductive system takes care of business. This is completely normal and healthy. It's just your body doing what it's designed to do. Don't stress about it, and definitely don't be embarrassed. It's as natural as breathing. Now, let's talk hormones, specifically testosterone. There's a lot of misinformation out there about this. Some blokes reckon that not masturbating will skyrocket their testosterone levels and turn them into alpha males. Others worry it'll crash their levels and leave them feeling rubbish. The truth: neither extreme is accurate. When you abstain from masturbation, your testosterone levels might see a temporary bump after a few days. Some studies have shown a small spike around day 7 of abstinence. But here's the kicker: it doesn't last. Your levels return to normal pretty quickly. So if you're thinking abstaining will permanently boost your testosterone and transform your life, I'm sorry to disappoint you, mate. It doesn't work that way. Let me share a quick story with you. I had a patient, lovely bloke in his 50s, came to see me because he'd decided to try this NoFap thing he'd read about online. He was convinced it would boost his energy, his confidence, his testosterone, the whole shebang. After about 3 weeks, he came back to my clinic feeling frustrated. "Doc," he said, "I don't feel any different. In fact, I'm more irritable than before. What's going on?" We had a good chat, ran some tests, and his testosterone levels were exactly where they'd been before. The lesson: your body regulates itself. Abstaining from masturbation isn't some magic bullet for hormonal issues. Now, beyond the physical effects, there are psychological and emotional changes that can happen when you stop masturbating. And this is where things get really interesting, because the mental side of things can actually have a bigger impact than the physical side for many blokes. First, you might notice increased irritability or stress. For many men, masturbation is a way to cope with sexual tension and stress. It's a release valve, both literally and figuratively. If you suddenly stop without having another outlet, you might find yourself feeling more on edge, frustrated, or having trouble managing stress. This is especially true if you've been using it as a regular stress management tool. I've had patients describe feeling more short-tempered with their partners or colleagues during periods of abstinence. Second, sexual tension can build up. The longer you abstain, the more intense your sexual desire might become. Some blokes report becoming more sensitive to sexual stimuli, whether that's thoughts, images, or physical touch. For some, this is frustrating. For others, especially those doing it as a personal challenge, it can feel empowering. It really depends on your mindset and why you're abstaining in the first place. Here's something that might surprise you. Some men actually report feeling more energetic or mentally clear when they abstain from masturbation. Now, before you all rush off to take a vow of celibacy, let me explain. This isn't a universal experience, and it's not necessarily due to the abstinence itself. Often, blokes who decide to stop masturbating are also making other positive changes in their lives. They might be exercising more, meditating, focusing on personal goals, eating better. It's hard to separate cause and effect. The increased energy and clarity might be coming from those other lifestyle changes rather than the lack of masturbation. I had another patient, a bloke in his early 60s, who told me an interesting story. He'd decided to stop masturbating for a month as part of a broader health kick. He was also hitting the gym, cutting back on the beers, and eating more vegetables. At the end of the month, he felt fantastic. More energy, better mood, clearer thinking. But when we really dug into it, he admitted he couldn't say for sure whether it was the lack of masturbation or all the other changes he'd made. My guess: It was the whole package, not just one thing. Now, let's address some of the myths floating around out there, because there's a heap of misinformation about masturbation and abstinence. These myths can create unnecessary guilt, shame, or worry, and I reckon it's time we put them to rest. Myth number 1. Abstaining from masturbation improves sexual performance. This is a big one, and I hear it all the time. The truth is, masturbation doesn't negatively impact your sexual performance at all. In fact, regular masturbation can help you maintain erectile function and better understand what brings you pleasure during sex. Sexual performance is more closely related to factors like stress levels, your emotional connection with your partner, and your overall physical health. If you're having performance issues, stopping masturbation probably isn't going to fix them. You need to look at the bigger picture. Myth number 2. Not masturbating improves fertility. This one's partially true but mostly misunderstood. Regular masturbation doesn't harm your fertility. Your body is constantly producing new sperm, and ejaculation makes room for fresher, healthier sperm. However, if you're actively trying to conceive with a partner, saving your sperm for a day or two before ovulation can increase the concentration in a single ejaculation. But we're talking about strategic timing here, not long-term abstinence. Your fertility is influenced by diet, exercise, overall health, and genetics much more than your masturbation habits. Myth number 3. Masturbation causes erectile dysfunction or other sexual problems. This is complete rubbish, folks. Masturbation doesn't cause erectile dysfunction. In fact, regular sexual activity, including masturbation, helps keep everything working properly. ED is usually caused by physical factors like cardiovascular disease, diabetes, or hormonal issues, or psychological factors like anxiety and depression. If you're experiencing ED, see a doctor. Don't blame yourself or your masturbation habits. Myth number 4. Not masturbating will make you depressed or anxious. On the flip side, some people worry that abstaining will cause psychological problems. The truth is, if you're abstaining by choice, and it aligns with your personal values or goals, it's unlikely to cause depression or anxiety. However, if you're forcing yourself to abstain because of guilt, shame, or societal pressure, that could contribute to negative emotions. The key is making a choice that feels right for you, not following someone else's rules. Right, so we've covered the science, the myths, and the reality. Now let's talk about what you can actually do to maintain good sexual health, whether you choose to masturbate or not. Because at the end of the day, that's what matters most, your overall well-being. First, and most importantly, listen to your body. Everyone's sexual health needs are different. If you decide not to masturbate, pay attention to how you're feeling physically and emotionally. Are you more stressed, more irritable, experiencing physical discomfort? Or do you feel fine, maybe even better? Your body will tell you what it needs. Don't ignore those signals. Adjust your routine accordingly. Second, keep the lines of communication open. Whether it's with your partner, your mates, or your doctor, talk about your sexual health. I know it can feel awkward, especially for blokes of our generation who grew up when these topics were considered taboo. But breaking that silence is important. If you have concerns or questions about masturbation, sexual function, or anything related to your reproductive health, don't be embarrassed to bring it up with a medical professional. We've heard it all, mate. Trust me. Third, adopt healthy lifestyle habits. Your sexual well-being is closely tied to your overall physical health. Eat a balanced diet with plenty of fruits, vegetables, and whole grains. Exercise regularly, even if it's just a walk around the block each arvo. Prioritize sleep, and manage your stress through techniques like meditation, yoga, or whatever helps you unwind. These things support not just your sexual function, but your mental clarity and general health as well. Fourth, don't buy into the hype or the guilt. There's a lot of noise online about masturbation and abstinence. Some people will tell you it's essential for your health. Others will tell you it's destroying you. The truth, as usual, is somewhere in the middle. Make your decision based on what feels right for you, not based on what some bloke on the internet says. If you want to masturbate, go ahead. If you want to take a break, that's fine too. There's no moral judgment here. It's your body, your choice. Let me share one more story with you before we wrap up. I had a patient, an older gentleman in his late 60s, who came to see me with concerns about his prostate. During our conversation, he mentioned he'd stopped masturbating years ago because he thought it was inappropriate at his age. He'd been taught as a young man that it was something only teenagers did. We had a long chat about the health benefits of regular ejaculation for prostate health. He left my office with a completely different perspective. A few months later, he came back for a follow-up and told me he'd started again, and not only did he feel physically better, but he felt more relaxed and less stressed overall. He actually thanked me for giving him permission to do something his body had been telling him was fine all along. That conversation has stuck with me because it highlights how much shame and misinformation surrounds this topic. So here's the bottom line, folks. Masturbation is a natural, normal, and healthy part of male sexual health. It has benefits ranging from prostate health to stress reduction to better sleep. But abstaining from it isn't harmful either. Your body is designed to adapt. You might experience some physical changes, like wet dreams or temporary hormonal fluctuations, and you might notice emotional effects, like increased sexual tension or stress. But none of this is dangerous or permanent. The secret to good sexual health isn't about following rigid rules or trendy movements. It's about finding a balance that supports your physical, emotional, and mental well-being. It's about understanding how your body responds and making informed choices based on that knowledge. Whether masturbation is part of your life or not is entirely up to you. There's no one-size-fits-all answer. Remember, everyone's body is unique. What works for one bloke might not work for another. The most important thing is that you're making decisions that feel right for you, decisions based on accurate information rather than myths or shame. Don't be afraid to experiment, to pay attention to what your body tells you, and to adjust as needed. And if you ever have questions or concerns about your sexual health, prostate health, or anything else we've discussed today, please reach out to a healthcare professional. That's what we're here for. Don't suffer in silence or rely on dodgy information from the internet. Get proper advice tailored to your specific situation. If you found this information helpful, give this video a like and share it with your mates who might benefit from hearing this. Subscribe to my channel for more honest conversations about men's health, because we need to keep talking about these topics openly and without shame. Drop a comment below and let me know your thoughts or questions. I read them all, and your experiences might help other blokes who are going through similar situations. Take care of yourselves, folks. Your health and well-being matter. Cheers.